inserting this nasogastric tube, again, what are the equipments that you need to bring?
The tray.
Tray.
Tape.
Okay,
Syringe.
syringe. No, the syringe is already in the
And the
refrigeration.
tray.
Just kidding.
Yeah.
I'm not just kidding.
The actual tube.
Lubricant and things like that, correct? Okay, so now you are giving medications. So what are those forevers that you need to do before you
Check your orders.
check the
Check
orders? Okay,
orders.
what else?
Hand hygiene.
Hand hygiene. Good.
Explain the procedure.
ID patient.
ID patient.
You forgot
Oh,
this.
knock
Oh,
on
knock on the door.
You know, some units they will write you up because you are not asking permission to enter their private space. I know this is the hospital space, but still, this is a private space that they paid. Okay, so you knock. Okay, introduce yourself, and then now when the patient is saying his or her name and the birthday, because you will say, "Can you please tell me your name and your birthday?" You know, don't like, "Okay, did you memorize the birthday?" I sure don't. So when the patient says the name, look at the band, and then the birthday, if what the patient is saying is true. Okay, all the time, right? So, okay, now, Mrs. Jones, I'm gonna give the medications. The doctor has ordered some medications for you to be given through your nasogastric tube. And Mrs. Jones had a tube feeding, continuous feeding. So make sure again that the head is elevated, right? Minimum of 30 degrees. Okay. Now, I have prepared all my medications and my classmate is here to canister when I give this. Before I give this, what else should I do?
Raise the bed high.
Raise the bed.
Rails
Good.
down.
Good. What else? Remember, I'm giving these medications now.
Explain the procedure.
Flush. Huh?
The 5 rights.
5 rights. How about checking if the tube is in place? What if it's in the lungs? So how do I check that? What are the methods of verification? Okay, gastric aspiration. Okay, what else?
X-ray.
X-ray.
X-ray. Excellent. That's the most accurate, by the way. Measuring. Check if it didn't move. What else?
pH.
Auscultation. Excellent. How do we do that?
I have a question about the X-ray. Are you're not going to be X-raying every single time?
No way,
though, right?
Jose.
The
That's an
radiation-
excellent question. You only do that on the initial, right after insertion, X-ray. But you're not gonna. If I have meds every 2 hours, are you kidding? They're gonna bring their stuff here. That's too expensive because the patient's gonna be exposed with a lot of radiation. So no, you don't. So what are the methods you can use at the bedside? I heard it. Auscultation. How do you auscultate? She taught you, right?
You insert a pose.
Okay, let's do it. You don't have to put it in your ears because I borrowed it from Aman and I promise our earwax will not be there. Okay. So, and oh, you need this?
Yes.
Okay.
Oh, I'm going to do the whole thing?
Oh God, yes. So that I'm here to correct you, to improve your practice, right? You might say, oh, I know that, but when you're there, oh, good, how did they do it? You know, so you have to really see, and I will show you how to do it, okay, the proper way.
Can we use it with this?
Yeah, you can use. So, no, right here. This is the top. So you see why I said do it, so you guys will know. Okay, top, and so it's off. So it's off. So you have to make sure it's on, right? So turn it no, the other way because it has to go this way to the patient, right? Okay.
So this side's turned on.
Yes, correct. So now she's auscultating. Amanda is auscultating to make sure we are in the stomach because I have meds to give. Okay. All right.
Then I would go to
So how much? Okay. Okay. Never put it on top of a gown. Never, because that's artifact sound. It's not real. Okay. And of course you have to have a gloves on, correct? She has gloves on. Let's just pretend. Yes.
so now I
Okay.
listen
Okay.
and a quick cursor there.
Okay, so you see how it disconnects. I'll show you how it is. That's why I said, how is it? So that you will know. That's my purpose of this. Okay, now, so I have the stethoscope here, like this. You know that the stethoscope, it has to point forward, right? It cannot be backwards. So I will not use it. You're the witness. Armand, I did not put it in my ears. And you don't put a lot of air. You can put maybe 30, okay? So you put it in the side and watch my hand, okay? Because if I do this, Okay, if I do that, it's gonna separate, and all the fluid will be in your face. You don't want that, right? So, watch me manipulate this.
Mm.
You see that?
Mhm.
That's how to properly do it. And then time it, because the patient may have vowel sounds. So I time it, it gets quiet, and I go, and you will hear, you know that's your sound, okay? Now, I have seen students do this like this. She held it properly. I was so happy. And then she was going, are we walking in the park or something?
So just
How
do
do
it.
you know that's your sound? So you have to, like, purposeful sound. You can hear. That's a wonderful sound. That means it's perfect. So we just said, oh, it's there. Okay, good. We're ready to give this medication. All right. Okay, Mrs. Jones, I'm gonna give the medications now. Okay. All right. So there's already one that's out. Okay. So I'll put this here. Okay. Okay. And it's still off. If there's a tube feeding, I will turn it off last because I don't want it to clog up. So it's there. And then I get my 30 ml water. That's when I turn off the tube feeding. Boom. Off. And the water just So I go, okay, and somebody else is helping me stir it. Next, okay, 10 ml in between. Once it goes down like there, not totally there, because I don't want air to be introduced, unnecessarily. Sometimes it's good, but it doesn't hurt, but I just don't. So we might do Harris flush. so it goes down. Okay, next. Okay, next. Okay, and this is the last one, 30 ml. Bam. And then it goes down. Okay, I put that, take this out, put this back, turn on the feeding. Okay, that's medication administration. Now, with I have 2 minutes. With peg tube, the same process, exactly the same, using this. Okay, and also I usually get a towel when I'm giving meds, because I don't know if I have a droplet and it's gonna be in her gown, and I just clean the bed. Oh, I don't want to do it again, so I always get a towel just in case I have droplets, and then I go from there, and then just give it. All right. Now, you'll be doing this again. Check with your faculty if a classmate can help. Because you would be nervous. In fact, I see the tube shaking. It's not the patient just shaking. So have your classmate there. I'm sure your faculty would say yes. 'Cause I always do. I said, if you want 5 of them to steer, go ahead. But you're the one administering it. Just you're new. So just some moral support, if nothing else. Even if some is standing like, go, go, go. It's okay. All right. So any questions?
Yeah, you said 30 ml before, 10 ml in between, or
Yes.
30 after.
Yes, correct. And also, I know I haven't told the other group, well, there's a different kind of peg tube. It's called a Mickey button. A Mickey button. Mickey is like mini is really bent. You know what? Because remember the one I saw you is like a big thing. That one, it's a Mickey button. It's like a button. Yeah, and it's, like teenagers when they have medical conditions where they need to be nourished because anorexia, whatever, bulimia, whatever they have, or there are other conditions. Now they can have that. It's so tiny that the same thing they can, whatever we're doing, same thing, but they can even wear like not too fitting clothes, but like
normal.
nice for teenagers. What they use now, I don't know what they use now. Tank tops, they can still use that because it's so tiny. It's called Mickey button. Okay, but that's not what we use in the hospital. But for those patients who are out in the community and still need nourishment to the peg, they can use that Mickey button. Okay, all right, yes.
in the event that they're going home with it,
Yes.
would you eventually teach them to do it and have them demonstrate how to do their own medication?
No, remember, they cannot go home with this.
No,
Oh.
with the
With the peg?
Yeah.
There has to be somebody, yes, you could teach them and like, okay, this is what I do, you can do this. So ideally there should be because in that condition, there should be a caregiver. You know, because these are medications and if they're usually the older generation, they cannot see well, there should be a caregiver. But if they are young, they're teachable, of course, they can put it. You know, they can do that, definitely.
What if they're hooked up to suction?
Oh, excellent. Okay, I'm glad you reminded me because I told the other group. Okay, what if this patient is hooked up to suction and I'm giving this meds because the doctor says give this meds, you know? So what I do, I turn off the suction. Always turn off the suction. Common sense would tell you that, right? Because I'm giving medication and it just goes in there. Can you imagine that? So I turn off the suction, give the medication. Do not turn on the suction until like 30 to 45 minutes because it has to be digested. Can you imagine? Okay, you turn it off and then turn it back on. It's just here's naloxone. So you see, it requires common sense also in our practice. Okay, excellent question. Thank you for reminding me because I told them that
30 to 40 minutes?
30 to 45 minutes. Yes, and check with the policy of the hospital. I always say that.
I had another classmate ask me if you have 2 tabs of the same medication, you can crush them and put them in the same thing. Or
What do you mean 2 tabs of, let's say, Lasix?
Yeah,
I
2
have
tabs of the
Lasix, 2 tablets. You can put it in one. Correct. Yes. You don't, not that. Okay, 1, 2, 3, 4. No, because it's the same medication. Excellent. Very good talent. That's a very good, question. Okay, you can.
And it's still the same ml, 10 ml for 2 tabs?
Yes, Cindy, it is still the same. Yeah. Good questions. Very nice.
How much fluid are you using when you mix the tablet?
Tablet is 10 to, actually sometimes if it's a lot, and I've done it, 15. But remember, one factor whether you use 5 or 10 ml to mix is, are they on fluid restriction? That's one thing that you need to think, especially if they're renal failure. You just put the minimum, 5 maybe. Another factor, if there's 25 medications, can you imagine I'm putting, how many is that?
A lot.
And the patient is bloated and, no, common sense will tell you not to do that, right? Okay. Good, excellent questions, guys. Okay. We're done.